Good afternoon, and thanks for joining us for today's Healthline 3. I'm Courtney Butts, and today on Healthline we have Dr. Antonio Pizarro with Willis Knighton joining us now. Thanks for being here.
It's my pleasure. Thank you so much.
Absolutely. Okay, so you are a local doctor here in the Arklatex with Willis Knighton. Tell us a little bit about what you do as a doctor at Willis Knighton.
I've been at Willis Knighton for 7 years. Before that, I was in private practice for 12 years. And my specialty is, in general, OBGYN. I'm a women's health specialist. I focus on disorders of what's called disorders of the pelvic floor. This has to do with symptoms of discomfort and urinary symptoms in the pelvis that can affect patients after childbirth. That's what I specialize in, but I also do other gynecologic care, care for patients with trouble with their menstruation or with pelvic pain. I also do some screening examinations to help determine whether patients are at risk for breast cancer or cervical cancer. Although I'm a subspecialist, and one might say an OBGYN subspecialist, every day, all of us as caregivers, whether we're nurses, whether we're physicians in whatever specialty, we encounter the patients who either aren't aware of some of the important things that sometimes can be common sense, that have to do with taking care of ourselves and promoting longer life, or sometimes we just need to remind them. And often patients say, "Oh yeah, my primary doctor told me I need to get colon screening this year, and I still haven't done it." And so it's important for us to emphasize that. And so, since, as you described earlier on the lead-in, this is a new year, and we often think about New Year's resolutions. It's a good opportunity for us to discuss those things.
Absolutely, yeah. January is the month of fresh starts, and can be a good thing because you're resetting, maybe refocusing on what's important to you, and maybe revisiting your why, to become a healthier version of yourself. And so those conversations are really important to maybe have with your primary care doctor or someone like you who is a part of their care team. But you talked about screening, and I think that's maybe an important place to start because it's also Cervical Cancer Awareness Month, right?
I didn't know that. To me, every month is Cervical Cancer Awareness Month. So I don't know that, but it sounds good to me.
Right.
The cervical cancer is, thank goodness, the amount of cervical cancer is declining somewhat, thanks in part to much better screening over the past I think 10 years especially, but also because there's a vaccine for cervical cancer. However, screening for cervical cancer, which refers to cancer of the opening of the womb, the cervix is the opening of the womb, which can be seen during a general examination of a patient. Well, that area can develop cancer, and so every 3 to 5 years, and perhaps more often depending on the patient, women need to have pap smears, generally up to age 65, and sometimes after that, starting at age 21 through age 65. And that's something that really shouldn't be skipped, and there are ways to try to prevent cervical cancer. As I mentioned, the vaccination has been well established, it's safe. But if a patient's been vaccinated, that doesn't take away the need to do screening. The other screening that immediately comes to mind is breast cancer screening. As many as 1 in 8 women develops breast cancer sometime in their life, and the life-saving measure is screening with mammograms. And that should start, there's different guidelines. The one I stick to is starting at age 40 every year. There's good and bad to all of that. Mammograms can be invasive, uncomfortable. They can be humiliating for some patients, literally painful for others, but they save lives. And so breast cancer screening is very important. And even for younger patients in their 20s, although mammogram isn't necessary, I have a number of patients in there who develop breast cancer in their 20s. And so what we call breast awareness is extremely important. I always try to emphasize that for my patients. Be aware of what's going on with your breast, because even men can develop breast cancer. It's rare, but it happens, and it can be devastating. So I think screening and being aware of those conditions, and of course, colon cancer screening. Not something that's a lot of fun to talk about. Well, none of this is fun to talk about, I'm sure, for many patients, but it's something that's important to me. Colon cancer screening is crucial. The guidelines now are that starting at, it used to be age 50, it's now age 45, and I think it's been age 45 for about 5 years now, if I'm not mistaken. Starting at age 45, routine colon cancer screening of one type or another, and there's different kinds. There can be a more invasive screening, which is colonoscopy, which is done by placing a camera literally into the intestinal tract, or DNA testing, or what we would say just stool sample testing. Either way, whatever your doctor or nurse recommends, I strongly advise patients this as we start the new year. If you haven't had that done, and if it's time, go get those tests done.
Absolutely, yeah. So these are all cancers that are pretty common for Americans, especially breast cancer and colon cancer. And so it's important to have that awareness, and that's something that you're able to do in your practice. And you probably look at their chart and see their age and say, okay, have you had these screenings done? And so it's just important to check in every now and then.
Oh, for sure.
Mm-hmm. Okay, so other things to focus on in 2025, we were talking about having like a healthier, or creating a healthier version of yourself, for the year, but it's really in those baby steps that is a good place to start. It's not like creating this overhaul of your health or your diet. It's really those small baby steps. So we were talking, you're wanting to talk about maybe like mental health and physical health, and also just nutrition as well. It's all those things. And so what are some of those baby steps that we can start with?
Oh, and you said that perfectly, because all of those things really are intertwined. It's difficult, for example, to have good mental health if you don't have a good diet. It's difficult to have to sleep well if you are someone who's suffering from mental health or has a medical ailment that's not well managed. And all of those things are intertwined. One thing to start with is mental health. Especially as the new year comes, we've had a stressful past few months. It's always stressful during the end of the year. It's cold, the weather changes, the holidays can be stressful. But there are patients, as many as 1 in 5 women who suffer, and at least that many men as well, who suffer or experience mental health difficulties. Things like depression, anxiety, other more potentially destructive mental illnesses, things that can disrupt life. And so some of those things become evident earlier in life. Sometimes, for example, schizophrenia, which is often we throw that word around, schizophrenia, but schizophrenia is a psychosis. It's a disease typified by hallucinations, by delusions, and by loss of the ability to control one's thoughts. And that sometimes becomes evident before age 25. Depression can affect children. Depression can affect patients who are much more advanced in age. So this is being able to recognize those things can be difficult sometimes for the individual, but for those of us who are in healthcare, it's our job to try to screen for those things, be aware of them, and refer to a specialist to manage that if necessary. But for our personal well-being, if a good way to notice whether someone is not, whether you're experiencing a mental health condition is, for example, if you're experiencing thoughts, changes in your mood, behaviors, or difficulty coping with life in a way that affects your work, affects your relationship with others, and that happens for more than 2 weeks, it's probably something that needs to be addressed. And that can be done in a number of ways, but recognizing it is, as it sounds trite, but it's true, recognizing it is the first step. And sometimes that can come with the help of a loved one. And so it's also important that we as members of a family tell our loved ones who are experiencing concerning behaviors that something needs to be addressed.
Sure, yeah. Well, if you're just joining us for Healthline today, we are taking your calls, and we're talking with Dr. Antonio Pizarro with Willis Knighton, and we're talking just about overall health and wellness and how to have a healthier 2025. If you have a question for Dr. Pizarro, give us a call at 318-219-4569, and those phone lines are now open, so give us a call and ask your questions. And I still have plenty of questions, so while we're waiting on your questions, we're going to move on. And still talking kind of about mental health. How can people tell? You were saying recognition is the most important thing, but how can people tell maybe if they have some kind of mental health condition?
I think a good way to determine that is whether you feel like what you're experiencing is affecting your ability to do normal activities. And a simple one is, for example, one of the sort of cardinal concerns of patients who have depression is that they no longer enjoy things they used to enjoy. Sometimes that may not be so obvious to the patient, but certainly someone else might say, a loved one might say, how come you don't play golf anymore? Or how come you don't read anymore? You used to love that. And so if we notice that about ourselves, that especially again is 2 weeks is a good round number. Certainly if it's longer than that. I used to love jogging, and I don't jog, but one might say, I used to love jogging, I don't jog anymore, I can't stand it. that could be a sign of a need for attention, unless it's something straightforward like, I just don't like to jog anymore, I have bad knees and I'm done with it, whatever. But if it's truly something that used to be fulfilling and is no longer enjoyable, then that's a concern.
Okay, yeah, good tangible way to maybe look at your, assess your situation. So, Barbara, thanks for joining us, and what is your question?
My question is, I have a niece that is 38, 39 years old, and all that he described in reference to schizophrenia, she was, the DNA test says that my mother suffered from depression, and her mother suffered from depression. And as she got older, I didn't know anything about depression and all of this. And so her mother passed away, and I've had her since, she was young. So my question is, how do you, like, when I take her to the doctor, I can't say anything. I really can't take her because they say that's privacy. But how do you do that? How do you get them into the doctor's office or get them to a person, a professional person, and these things that he described is going on?
I'm sorry you're going through all that with your family. It sounds like you and your loved ones have experienced a great deal of difficulty, and I'm sorry, I guess it was your sister that died, is that correct? Well, I can't hear anything, but sorry that you've been through so much. I will say that when privacy is always a concern, we have to start with this journey with one step. And so if you've had an opportunity to speak with your niece about your concerns, that you feel like she's not acting the way that you would like to see, that you're concerned for her health, that you're concerned for her safety, letting her know is a good first step. Also, if she welcomes you to the doctor's visit, if you can say, hey, I'd like to go with you to the next visit, do so, and have a conversation with the doctor or the nurse, whoever you're with, and say, I want to be part of this conversation. Is that okay? She can give permission right then and there. And then you can ask her if you can discuss your concerns with that doctor or with that nurse. And start with that. It might be one visit at a time. This can be a very difficult thing. Mental health issues can be very stressful and concerning, and privacy is of the utmost importance, but taking those first steps are the way to go.
All right, yes, great advice there. And if you have a question or topic that you would like Dr. Pizarro to address today, we're kind of talking about just having a overall healthier 2025 general wellness tips. And if you had a question or specific question, give us a call, 318-219-4569. So we've talked about mental health, and we're kind of covering a lot of different bases here, but diet is also another factor that is important, that it can also maybe even impact your mental health as well, like the gut microbiome, kind of all intricately connected. So why is it important to have a healthy diet?
We always talk about that. I mean, and it does tie into mental health, because so many things, often, I want to make a quick comment because you said something very crucial there. Often patients will say something like, oh, this is in my head. I mean, if we think about it, everything has to do with the way we interact with our minds. Mm-hmm. So if someone punches me in the face and it hurts, I'm feeling that because of my brain. So I always tell patients, even if it's so-called in my head, it's still real. Mm-hmm. It's still something that we need attention for. And diet affects everything about us. And we hear about that. You are what you eat, these things that, eat healthy. Well, there's science to back that up. I mean, there's very simple things that many people in the audience know that are common sense. Take vitamins. Well, why specifically? Vitamin C helps us heal. If we didn't have good vitamin C on board, every time you got a cut, it would heal poorly. It'd be more risk for infection. Vitamin A helps you see at night, helps young children who are vitamin A deficient. They often suffer blindness in underdeveloped countries. Mm-hmm. So vitamins, this sounds it's like such common sense, but right. This never changes. And so as we age, our nutritional needs change, but there's always an underpinning of, if you're not getting the right kinds of foods, and if our intestines aren't behaving properly because we don't get enough fiber, we don't get enough things like probiotics in our mm-hmm. diet from yogurt or from supplements, our immune system won't function well. We won't sleep well. We won't have proper ability to cope with pain and cope with stress. So this sounds kind of, almost oh, that's just stuff my mom used to talk about. But diet is crucial. So we must maintain our diet. And a good way to do that is simply to eat, as we've always talked, eat in a balanced way. If you're having some questions about that, eat more vegetables. Eat less of one thing. If you find yourself constantly eating just broccoli, that's probably not good either, if that's all you eat. So have a varied diet, but focus on, if you're going to snack on an apple instead of on that chocolate bar. Things like this that are common sense, but why? Because if you eat chocolate all the time, well, maybe your cholesterol will go up. What does that mean? Some of the fats in our blood build up, and what can that do? That can lead to heart disease, which is the #1 killer of Americans. So these are things that all tie in together and are must be emphasized.
Yeah, and it's so layered too, but yeah, like you said, it's starting with that one thing and make it an achievable goal instead of like completely starting over and tossing everything out of your pantry and starting over with something completely new. That can be a little daunting, but if you just start with maybe eating a serving size of vegetables a day, then that can maybe lead to the next thing.
Totally true. And sometimes patients will ask me, well, how can I lose weight? I'm not an expert in weight loss. But one thing I would say is, and it's very common, is that if a patient eats a lot of white foods, white bread, white rice, white pasta, those aren't bad for you as such. Those are good. Have a lot of white rice. White rice has a lot of vitamins. It's very good and has high in fiber. It's a good food. But if you're interested in losing weight, switch to brown rice, for example. It takes longer to cook. It's not much more expensive, but it takes a little longer to cook brown rice than white rice. But the sugar content that your body absorbs is lower in brown rice. So things like that a dietitian might be able to help us with, or that you can go online and just look into that are minor changes. Because if you eat rice 6 times a week, which is, hey, if you like gumbo or if you like etouffee or whatever, you might do that. Well, consider switching over to something different and see if that helps take out some of the calories. So as you said, it's baby steps. There's not going to be this one thing, but I think as we begin the new year, it's simply important to reemphasize how we can't lose sight of these, because all of these things are habits and it's an approach to our lives. I skipped my colonoscopy last year. I should do it this year. I also eat a lot of red meat. I know that's not good for me. Instead of eating 4 steaks a week or 5 hamburgers a week, I'll eat 2 and I'll eat something else. You see, so as you described, it's about balancing what we do and taking it in increments.
Yeah, and like to your point about the rice, just using that as an example, combining foods can be really helpful, so it doesn't spike your sugar levels, your insulin, so you become insulin resistant. So combining foods like fiber to something that's maybe starchier like rice, and protein, so it helps slows down that digestion. So it's not like you can still maybe have the rice, but in a more balanced way. Yeah.
No question about it. And also you mentioned diabetes. These are the types of things that we hear so much about on television and in other media. Diabetes, heart disease, high blood pressure. My blood pressure's up. Well, let's just talk about blood pressure. If a patient is struggling with weight, but I'll say that many patients have trouble with their blood pressure and are rail thin. So weight isn't the only factor, but let's just focus on that for a second. We know that patients who are larger, what we call the body mass index, which is their weight calculated by the height, and I don't remember that calculation, but the weight calculated by the height, after that, what we call body mass index is measured at 25 or higher. That's when we say a patient has issues with their weight, overweight or obesity, starting with that BMI at 30, obesity. That increases the likelihood of 2 conditions, diabetes and high blood pressure. Diabetes is a condition where the sugar in our body is not regulated well. One might say, well, it's just high blood sugar, but that blood sugar, the way it affects the body, it can harm the heart, it can harm the kidneys, it can harm the eyes, lead to blindness. That diabetes, when it's uncontrolled, can harm the blood vessels and lead to poor healing, amputations, loss of limbs. This is serious stuff. High blood pressure can do all that and much of that, and if we have high blood pressure, even if you don't feel bad, it can cause increased risk of stroke, which can lead to death and disability for millions of Americans. Heart attack, again, poor healing, kidney damage. Many patients that have loss of kidney function end up with dialysis and kidney transplants is because of uncontrolled high blood pressure. So when we talk about blood pressure, we often don't really focus on what that might mean down the road. And one way we can help to reduce our risk of developing uncontrolled diabetes, uncontrolled high blood pressure, is to control weight, increase activity, improve our diet. And these are all important things. And if we're struggling with mental health and we're suffer from depression and we can't function, I think it's going to be much more difficult for us to eat healthy, to exercise enough.
Yeah, and exercise is also another big topic in this area too, that I've heard the saying, you can't outrun the fork, or, you can't outrun a unhealthy diet or anything like that. But, there is really some benefits for just plain exercise too. So if you want to talk about that as well.
Oh, thank you. Exercise is, again, one of these things, especially on the new year and with these resolutions. We often in our society, in American society, think of, we got to go to the gym and it's such a hassle, and it does require an effort. But why is exercise important? We know that the proper amount of exercise will reduce your risk of dying young, reduce your risk of conditions that we described, reduce your risk of diabetes and high blood pressure. Improved physical activity will reduce the risk of depression. It will improve your sleep. Now, this doesn't mean, as you mentioned earlier about sort of taking things in steps, that we should all join a gym, which costs money, requires a commitment, etc. All these things that can be daunting. Increasing your activity, especially if you're someone who doesn't have a lot of activity in your life, can be as simple as, when it's safe, everything safely and everything being sure that, if you're someone who's very ill and can't walk around very much, talk to your doctor and all that. But something simple like, instead of parking in the grocery store, at the nearest spot, don't even try. Park far away if it's safe, if it's not raining or something. Park far away, take your time and walk. Now, if you're so unhealthy that it's that, and I'm not kidding about this, if you're so unhealthy that it's difficult to walk that distance, then don't do that, but that probably deserves some attention. You might need a handicap sticker or whatever, but don't look for that near spot. Look for a far spot. If you can take the stairs, do so if it's safe to do so. If you can, at home while you're watching television, don't just sit there, even if you're just standing while you're watching television or walking in place. I mean, this sounds kind of silly, but it's real. And if for someone who's not very active, adding these things in little bits can be very useful.
Yeah, and I've heard that referred to kind of as like habit stacking. If you're going to scroll on social media, maybe pace around, maybe bring it up so you're not, losing that posture. So yeah, great tips. We have another caller. Bella, thanks for joining us. And what is your question?
Yes, ma'am. I was just wondering, I have a condition and I can't gain weight. It's really hard. I mean, I do my lazy exercise and I go up downstairs, to keep my muscles, from what's it called, atrophy or whatever. But how do I gain weight?
You said you
I have a
Bella, you
Yes,
said
sir.
you have a condition that keeps you from gaining weight. Is that correct?
Well, I used to weigh like 125. Now I'm down to like 89 and 90.
And just so I'm clear, did you say you have a condition that has caused that? Is it a condition that has been diagnosed and is being managed?
It's been diagnosed, but it hadn't been managed, really.
Okay. Well, if you have a diagnosis of a condition that's leading to what sounds like pretty dramatic weight loss, the first step is to get that managed. And if it's not been specifically diagnosed, then I would strongly recommend that you get attention as soon as you can. Call your doctor today and get some attention to that, because there are some serious things that can lead to rapid weight loss. And it may not be something...
I think I need an older doctor.
Could you say that again?
I said I think I need an older doctor. I have a young doctor.
Well, I'll leave that to you. I think you please pick a doctor you're comfortable with, of whatever age, and you got or a nurse practitioner, a PA. You have to feel comfortable with who you're with, and that's a good start. So in general, specifically to you, given what you told me, it sounds like you need to get some attention to whatever's causing you to lose weight. However, in general, when someone is difficulty gaining weight, if it's not due to a underlying medical condition or some medicine that someone's taking, or if it's not due to perhaps a mental illness that's leading to that. Some patients who are depressed sometimes don't eat. or have some other eating disorder. If it's not that, then getting attention from a dietitian to see what foods might be appropriate for you, might have more calories. It might be as simple as having not an energy drink, but having a nutritional drink. Not an energy drink, not Red Bull, don't do that. Something with calories with you all the time. That it could be just as simple as that. But from what you've described, I strongly urge you to check with your doctor, or get a new one if you need to, and get that condition you mentioned addressed right away.
Yeah, I have a hereditary. It's a type of hemochromatosis, but it's they don't think it's turned into the Vera yet.
Okay.
You know
Right.
I can't remember the name of it.
My understanding is that hemochromatosis affects the liver. It can affect the way the liver functions, and that's a very complicated and a specific condition that I think deserves specialty attention. And if that's the reason that you're not gaining weight, then
Well, my liver and everything's good because I make sure they keep blood tests every 6 months.
Okay. And so I think if you mentioned earlier that it may not be being managed, I think that's the first step. And then after that, once you get that leveled off, then the straightforward things like adding the right foods into your diet and being sure you're not too active, not doing too much exercise, because that can be harmful too.
No, I'm not. It's polycythemia.
Okay, and that's
I don't like telling people.
Oh, I understand. I didn't mean to pry, and I certainly respect
Oh,
your
you
privacy.
didn't. It's kind of embarrassing,
Yeah. Well, it looks like polycythemia is a condition where the number of red blood cells in the blood is abnormally high, and it can cause a number of stresses on the blood vessels. And it sounds like in your case it's leading to some liver changes, and of course that's best often managed by a blood specialist, a hematologist. And I think, Bella, in your case, you need some attention to those things.
All right.
My
Go ahead.
liver and all.
Well, I think
What
from
type of specialist?
you might check with your primary first, because they might have all the tools at their disposal to manage that. But liver disease is routinely, from the standpoint of a specialist, is managed by what's called a hepatologist or a liver specialist. I almost never use those words. I use liver specialist, bowel specialist, heart specialist, just to keep it straight. But the technical term is a hepatologist. But I think checking with your primary might be the first best step, and you might make a call to them today.
All right, thanks, Bella, for your question. And we have just a couple minutes left. Briefly talk about how important sleep is.
So I'm glad you asked that. Sleep is the underpinning of so many things. It is really, in college, I had a brief lecture that someone said this loss of sleep is a psychological need, not a physical need. And we know that's not true. It is a physical need. And so if we're not getting enough sleep, we often recognize that. Others around us recognize that. It's pretty self-evident. I feel tired most of the time. And so good ways to try to first of all, if it sounds like it's something severe, get attention, no question about it. But simple things like don't use the bed for anything. If you're having trouble sleeping, don't use the bed for anything other than sleep and intimacy. Don't watch TV in bed, don't read in bed, because that teaches you to be awake in bed. If you're having trouble getting to sleep on a given night, it's taking you more than 10-15 minutes to get to sleep, get up, go do something else, because then again you're just fighting that, and that puts you in fight or flight instead of sleep. And so sleep has been shown, when it's not good, has been shown to increase risks of depression, increase risks of other illnesses, and of course something simple like if you're not getting enough sleep, you're simply not going to be able to function well with your loved ones and at work. So this all seems obvious, but we lose sight of that often, and we often say, oh, well, I'm just tired, I'm just fatigued. Well, that could be because you have a medical condition, but if you're not sleeping well, it requires attention.
Very important stuff. Well, thank you, Dr. Pizarro. Tell me where we can find you and what phone number to call if someone's interested.
My office is in Willis Knighton Piermont, Suite 370, the office number. The main number is the best number to call, 212-3000. It's easy to remember, and then just ask for me.
All right. Well, thanks for joining us. And if you wanted to maybe rewatch this episode, or if you were just tuning in, it'll be on our website at ktbs.com/podcast.